So you might be worried about your son's anxiety, depression, mood, mom, or and you've thought about other things and you're worried if medication might be the next step. So here's how to know. So my name is Agam Dewan. So I'm a board certified psychiatrist and child and adolescent psychiatrist as well. And so I work with moms to help you make your sons thrive. And so what I tell patients is that meds are a tool and they're not always the answer, but they can be in the right case. So for example, I recently just had this 18-year-old kid, and he was having a lot of aggression and irritability. Like, that was the biggest complaint that his mom had. So, what she said was that he got angry at the smallest thing. Sometimes he would lash out, sometimes he would even hit walls, right? It was like kind of like he was like a fuse. His friends said that whenever he would game, he would get extremely irritated. Like, that was their main complaint. And so, he had tried some therapy, tried some self regulation, and that didn't really work. He wasn't really interested in more of the lifestyle changes. And so the mom came to me for help because she said, "Hey, what can I do to help him be calmer?" And so in his case, we started a medication called lamotrigine, and because I really wanted to focus in on the irritability. And so I see the mom a few weeks later, and she's like, "Oh my God, like he's home, and like everything just feels so calm and peaceful." Apparently, his friends have been saying that he's way more relaxed than he used to be. She's saying that like things that used to be a fight aren't a fight. She says that when she's on the phone with him, over when he's at school, he is way calmer and like he just seems more relaxed. And I talked to the kid as well too, and he even notices the same thing. So that was a case where even we literally just had him on the smallest dose, 25 milligrams. So that just made a huge difference for him. But I've had other kids. For example, I had this 18-year-old girl actually, and so she had a lot of social anxiety. That was her thing, and we asked if they were considering medication, and they said no, we don't want any medication. And so said, okay, why don't we do some supplements and lifestyle changes? So we started a supplement called Saffron, and then we also started doing lifestyle changes where like we cleaned up her diet. I checked her food sensitivity, and she was sensitive to some foods. So we did an elimination diet where we eliminated some of those foods. And she started focusing on sleep a lot more too. Like, she was very interested in these type of changes. And then, a month rolls around and she says that, hey, I feel great. Like, the things have changed. Now I don't even think that I need medication anymore. So I'm like, okay, like awesome, sweet. So that's the other example, right? So basically, now you got to decide, okay, does your son or daughter, do they need medication or not? Or do you need medication, right, for whatever struggle you might be having? So here's 3 signs that you or your son may need medication. One is that his issues that he have is affecting his day-to-day life. So, for example, if he's in school and he can't focus, or if teachers say he gets around and runs around all the time, or you have trouble focusing at work, that could be a sign. You might get angry a lot in relationships with your boyfriend or girlfriend. It might be hard to maintain friendships. You may not feel motivated to go out and socialize. You may not feel motivated to go out and accomplish the things that you need to, right? You might have severe anxiety and panic attacks that are stopping you from doing stuff. So if it's severely affecting your life, then that is a sign that you might need some medication. Because the way that I think about meds is that they're just a tool. They're a tool that can help us get to where we need to go. That's it, nothing else, right? It's not like a magical fix, or it's not the devil either. It's just a tool that we can use. So another sign is that therapy and lifestyle changes aren't enough. So I've had plenty of patients where they say they want to start with some of the natural approaches. And so we say, okay. And so we start with the natural stuff. But then they come back a few weeks later, a month later, and either they found the natural stuff hard to implement. For example, I had a 13-year-old kid, and basically they wanted natural things, but then, they didn't follow through with any of the diet, lifestyle changes. Sleep was really hard. The kid didn't want to prioritize that. And so we started ADHD meds for him, and that made a huge difference. So oftentimes, like the lifestyle changes and other stuff isn't enough to improve the person's functioning, and so that's where meds come in. And then the third reason is, of course, if the symptoms are severe or they're worsening. So if you find that, before you could get out of bed and do stuff and now you can't even do that, or your panic attacks were maybe like a 4 out of 10 and now they're an 8 out of 10, or you start having suicidal thoughts, or you just got reprimanded at your job because you forgot some important deadline, right? Like now these are signs that, okay, things are worsening. For example, like I have a lawyer and 38-year-old lawyer, and so he's on Adderall. And so in his case, he had ADHD before. He was getting treated in law school. Did fine for a while, but then now he's joined a new firm and he's working extra hard, extra long hours. He just had kids too, so things like sleep are struggling. He said his diet struggled a little bit too, and so in his case, medication made sense to help him get through the like the tougher times that he's having. But then, times when medications aren't necessary can be if your symptoms or your son's symptoms are mild, or you start implementing lifestyle changes and like implementing some structure, and it does start making a difference. If he responds well to, let's say, therapy, routine, discipline, right? Like if he's very bought in, if he's invested to those lifestyle changes, if he is like, you can set up parameters like changing the diet, for example, in the house, and he doesn't fight you, or he's willing to go to therapy, then often a lot of those times the lifestyle changes can make the difference. And if you haven't tried the options long enough, right? So sometimes they'll want like a change, right, in their anxiety, let's say, but then they've only been to therapy for a couple sessions. Well, like that might not be enough to fully make those difference, right? The lifestyle stuff also takes time. Generally, I find the best results are when you combine the both, meds plus lifestyle plus therapy. That will get you the fastest results possible. But, many people want to avoid that, the med side of things. So I get that. So some people have myths about medication. So one is that they feel like meds will change you or your son's personality. So no, that's not true, right? Some people do say that they feel more numb from medication. They feel more like a fog. Usually that tends to happen at the beginning, and it tends to go away within a couple weeks. So I think that's reassuring. A lot of other people feel that like if they start medication, then they'll never be able to stop. So I do have some patients who I do think will be on meds for life, right? But that's more of a reflection of their underlying condition, right? Like if their underlying condition is severe enough, then they're going to be on medication. But many kids I've worked with, they only need medication, for example, in high school. And then in college, they go off and they're good. Or they take it for college, and then, once the brain matures more, then they're fine. Or they might take, for example, I had a colleague who took antidepressant Lexapro in his residency because he found residency very stressful. But then once residency ended, he stopped, and he said, like, yeah, he was good because he was able to correct a lot of his other lifestyle factors like sleep and diet and things. So meds necessarily don't. I think about meds like imagine if you're stuck at a bottom of a well. Medication is like a ladder, and so you climb this ladder up, but you still have to climb, meaning that the meds are just a tool to help you rise. So ideally, once you've risen, like, once your cast is healed, then you take off the cast. So similarly with the medications as well. And lastly, some people think that they're a failure if they use medication. So, like, no, I'm not sure where this comes from. Like, meds are just a tool. They're not anything special. It's not like a reflection of you morally, right? Like, mental health, it's a brain health problem, and so we're just trying to help correct your brain. And meds are one way to help those symptoms. So that way you can lead a functional life. Just like you take meds if you have antibiotics, if you have an infection. Right? If you have diabetes and your glucose is skyrocketed, you'll take insulin to help reduce that. Like cough medicine, same thing, pain medicine, right? Same kind of concept. Blood thinners, heart medication. It's just a tool to help the part of your body, the brain, function better. That's all. So I hope this is helpful. So just to summarize, meds aren't for everyone, but it can be life-changing for some people. And so if you're interested in like learning more and maybe you want to work together about you or your son's condition, then feel free to book a consult in the link down below. And I will see you in the next video.